Hi everybody, if you are under 40 years of age and considering a facelift, then this video is for you. Today's a little bit different than a lot of the other videos I've created because I've sort of curated a set of questions and answers based on my younger facelift patients. My younger facelift patients include those who are not traditionally thought of as candidates for facelift surgery, which is a pretty major operation that carries with it its own unique set of risks. So, for all of the patients that are considering a facelift and are under 40 or 50 years of age thinking, am I too young for a facelift? The best starting point is to ask yourself, how old do I need to be to have a facelift? This is not an age-old question. This is a question that has come about in more recent years as the trend in younger patients to have a facelift becomes more prevalent. To answer your question, honestly, you need to be a consenting adult. If you are a candidate for a facelift and you're a consenting adult, it's discrimination to say you have to be this tall to ride. The truth is, if you can safely improve your appearance or achieve certain aesthetic goals by lifting the skin in your face, there's no such thing as too young. I have operated on patients in their 20s quite often, and I'm sure there are people nationally and abroad who have operated on patients who are even younger for the sake of improving their facial appearance. In Korea, for example, it's very common to have double eyelid surgery when you're a teenager, and still in other countries and the US, if you have ptosis of your eyebrows, which is age indiscriminate, then even at birth you can have this corrective operation. So, cliff notes. There's no age cutoff, but you have to be consenting, and you need to be realistic and educated and understand the real consequences and risks of surgery prior to embarking on the journey that we call a facelift. A very small proportion of my patients are under 30 years old, but in the past year alone, I think 2 or 3 have been, and I think that's an important statistic to consider. I don't discriminate, but there are usually options that are better for younger patients. Question number 2. So you get a facelift when you're 26. What are the telltale signs of a facelift? When you're 26 years old and you undergo a facelift, there's no question we can make you look better. That's why I would even agree to do a facelift on certain patients in their 20s and 30s. If I feel that simulating the effect of a facelift truly improves your appearance, then you are indeed a candidate for the operation. But when you're in your 20s and you have facelift scars, it's going to generate questions that women and men in their 40s and 50s probably wouldn't inspire, because their contemporaries are probably like, what is going on with this scar on the side of your ear? And so the question, how do I minimize scars and what are the telltale signs of a facelift, do become more relevant. So, in brief, the telltale signs as I see them of a facelift are, number 1, funny looking ear traguses. So if you are missing your tragus, which is this little cartilage flap in your ear, or you have a pulled ear, it's pulled down and giving you a pixie-like deformity, those are 2 obvious telltale signs of a facelift, especially relevant to the younger population. Number 3 would be visible scars. If you have visible scars, that's obviously a telltale sign of a facelift. I would say that in my patient population, the younger you are, the less bruising you typically have, the better recovery you have, but not necessarily better scarring. Better scarring when you have young skin that wants to heal a lot and is very thick. Sometimes we've got to do our best to minimize these scars, which are the most noticeable in my practice sign of a facelift in a younger patient. So, this is a great segue to the next question. Do you have any tips or tricks to make scars less noticeable, and what can I do to make my scars less noticeable? So, as a plastic surgeon, there's definitely a lot that I do to make scars less noticeable. The most important thing I do is I share the tension of pulling across multiple levels. If you're putting all of the stress on the skin, it's putting a lot of mechanical strain on that healing wound, which is going to make the scar more noticeable and thick. So by offloading that, by doing a deep plane or a SMAS type facelift, then you are going to have less noticeable scars. Also, if you don't get greedy and pull too tight, those scars will be less noticeable. Finally, by beveling my edge of my blade and hiding scars in the hairline and not necessarily along it, you really have a much easier time concealing scars that are noticeable for the first 2 or 3 months after a facelift operation. So that's what I can do. What can you do? Things like wearing makeup prematurely, overdoing it, exercising, just trying to go too far too soon. If you look good, you feel good, you go out and you start putting makeup on, sweating, going out, drinking maybe. I think these stressors can cause delays or a hyperactive response and inflammation in facelift scar healing. And if you don't just take it easy for that first month, you're setting yourself up for longer, more visible scars. All right, the last question is about perioral mounds. But I'm not going to answer that in this video. Stay tuned, subscribe, and if you like this video, if you like the topic of these videos, please don't hesitate to ask below in the comments section about your own questions. In the next video, I'm going to talk about these little things called perioral mounds, which are a real hassle, but I am coming closer to a solution, and I can't wait to share that information with you.